At 47 years, Cecilia lived with hypertension for over 2 decades, a condition she thought was only associated with older people caught up with her at her mid-20s. In fact, for 1 year, she was not aware that she had hypertension.
And until the first time I went to hospital, when I thought now I was feeling so bad I couldn't breathe, I was feeling like there was something compressing my chest, some like 50 kilos. It's like a bag of cement being put on your chest.
Blood pressure has no symptoms. So many people will tell you that I have dizziness or I have headaches, but the symptoms of hypertension are usually mild or in many patients non-existent. So you would not know you have hypertension.
After the diagnosis and weighing 120 kilos, her life had to immediately change to prevent the condition from getting advanced. And this did not only affect her diet, where she had to cut off, among other things, salt, red meat, fried foods, alcohol, but also her social life.
The things that you used to enjoy before, going out with friends, making noise, those are very costly. You have to keep more indoors. Friends make you anxious. Yeah, they make you anxious. You're all the time excited. What is next? You can't afford that because your body pumps something called adrenaline, and that affects high blood pressure.
Hypertension is a condition of the body where there's an abnormal elevation of the blood pressure with figures above 120/70 and 140/90. The condition can be classified into two: essential hypertension, which has no identifiable cause, and secondary hypertension, which is as a result of an underlying cause like certain diseases.
If you find the cause, for example, a tumor that's producing an excess amount of a hormone that is raising your blood pressure, if you remove the tumor, the blood pressure comes down and you go off your medications. But that's not common. What is more common is that patients come in with high blood pressure. They start off on 1, maybe 2, or even sometimes 3 medications, and that is used lifelong.
Many myths about hypertension make the rounds, and as much as some of them have no truth in them, others are facts. For example, more black people get hypertension as compared to whites.
Blacks, when they have hypertension, tend to be younger. The hypertension tends to be more severe, and they are less well controlled. So that means their blood pressure is not at the optimal target.
But according to Dr. Otieno, it is not true that more men are affected than women. Hypertension is controlled by lifestyle modification, taking medication, and secondary treatment like surgeries to remove other causes of the blood pressure like tumors.
We control blood pressure, reduce the risk of stroke, heart attack, kidney failure. But what you do today is what affects you 10, 20 years from now.
Life for someone who is hypertensive can get challenging, and a lot of support is required from family.
Try to annoy them less. When they've done something wrong, no matter how annoying, please don't shout at them, because that is enough to kill them.
Although there are no known support groups for patients with high blood pressure, a lot of information can be acquired at any hospital. Hospitals also have open days where they carry out free blood pressure checks and educate the public on hypertension. Olivia, Okech, Sunday Live.